Hello everyone. Today in this video we are discussing some of the most important terms from which questions can be expected for the upcoming AIIMS nursing officer examination. Battle sign, also called mastoid ecchymosis. It is a bruising over the mastoid process, as you can see in the images. It is an indication of fracture of middle cranial fossa of the skull. It is named after William Henry Battle. Next term is raccoon eyes. Raccoon eyes also called periorbital ecchymosis. It is a sign of basal skull fracture or subgaleal hematoma. It is also known as panda eyes in some countries like UK and Ireland. In the picture you can see how this condition is seen. You can memorize this image, and when this image is shown, sometimes question may be like this, showing this image, what is the condition. So you can memorize this image and understand this as raccoon eyes. Next one is Homans sign. Homans sign or dorsiflexion sign is considered to be a sign of DVT or deep vein thrombosis. It was defined by John Homans. The pain in the calf upon forced dorsiflexion should be considered a positive sign. As you can see in this picture, you can ask the patient to lie down and you can dorsiflex the foot. Then the patient complains of pain. And if this sign is positive, it indicates DVT. Next term is D-dimer. D-dimer is a small protein fragment present in blood after a blood clot is degraded by fibrinolysis, also called fibrin degradation product, FDP. It is used in diagnosis of thrombosis, disseminated intravascular coagulation, DIC. A fourfold increase in the protein is a strong indication of mortality in those suffering from COVID-19. You can see in the current scenario of this pandemic COVID-19, if a patient is COVID positive and if this protein D-dimer is present in his blood, there is a chance of mortality for the patient. Some more information about DIC. It is a condition in which blood clots form throughout the body, blocking small blood vessels. The symptoms may include chest pain, shortness of breath, leg pain, problem in moving parts of the body, etc. As the clotting factors and platelets are used up, bleeding may occur in this condition. This is an important point because in the name it is disseminated intravascular coagulation. But here the manifestation may come as bleeding. So you should not confuse with this. The bleeding occurs in this condition because as clotting factors and platelets are used up. Next point, and causes blood in urine, blood in stool and bleeding into the skin. These are the manifestations of DIC. Complications may include organ failure and widespread bleeding due to deficiency of clotting factors and platelet. Findings may include low platelets, low fibrinogen, high INR or high D-dimer. Treatment is mainly directed towards treating the underlying condition of the patient, and other measures we can include are giving platelets, cryoprecipitate or fresh frozen plasma, FFP. Another information about DIC is that DIC occurs at higher rates in people with bacterial sepsis, 83%. Then other conditions are severe trauma, 31%, and cancer, 6.8%. Another important term is Kasabach-Merritt syndrome. It is also known as hemangioma with thrombocytopenia. It's a rare disease, usually of infants, in which a vascular tumor leads to decreased platelet counts and sometimes other bleeding problems, which can be life-threatening. It is also known as hemangioma thrombocytopenia syndrome. Here, low platelets occurs due to a vascular tumor. Another one important term is HELLP syndrome. It is a complication of pregnancy characterized by hemolysis, elevated liver enzymes, and low platelet count. It is usually seen beginning during the last 3 months of pregnancy or shortly after childbirth. Symptoms may include feeling tired, retaining fluid, headache, nausea, upper right abdominal pain, blurry vision, nosebleeds, and seizures. Complications may include disseminated intravascular coagulation (DIC), placental abruption, and kidney failure. DIC we have seen in the previous slide. It is a dangerous condition. So the DIC can occur as a complication of HELLP syndrome. Another term is cryoprecipitate. Cryoprecipitate is a frozen blood product prepared from blood plasma. One of the most important constituents is factor 8, also called anti-hemophilic factor or AHF, anti-hemophilic factor, which is why cryoprecipitate is sometimes called as cryoprecipitated anti-hemophilic factor or cryoprecipitated AHF. Some other points regarding this cryoprecipitate. It is used in treatment of DIC, disseminated intravascular coagulation, and massive hemorrhage condition, etc. Then cryoprecipitate can be stored at -18 degrees Celsius or colder for 12 months from the original date of collection. Another term is rhabdomyolysis. Rhabdomyolysis is a condition in which damaged skeletal muscle breaks down rapidly. Skeletal muscle breakdown happens here. Symptoms may include muscle pain, weakness, vomiting, and confusion, abnormally raised or increasing creatinine and urea levels, falling urine output, or reddish brown discoloration of the urine. The most reliable test in the diagnosis of rhabdomyolysis is the level of creatine kinase (CK) in the blood. This enzyme released by damaged muscle and levels above 1000 units per liter, that is 5 times the upper limit of normal value, indicate rhabdomyolysis. More than 5000 units per liter indicate severe disease or severe rhabdomyolysis, but depending on the extent of rhabdomyolysis. Another term is direct Coombs test. The direct Coombs test detects antibodies that are stuck to the surface of the red blood cells. That is important. Direct Coombs test detects antibodies that are stuck to the surface of the red blood cells. Another type of test is an indirect Coombs test that we will explain in the next slide. The next point, since these antibodies sometimes destroy red blood cells, a person can be anemic and this test can help to clarify the condition. To perform the test, a blood sample is taken and the red blood cells are washed, removing patient's own plasma and unbound antibodies from the red blood cells, and then the washed plasma is incubated with anti-human globulin, that is Coombs reagent. If the red cells then agglutinate, the direct Coombs test is positive. The direct Coombs test is used to test for autoimmune hemolytic anemia, that is a condition where the immune system breaks down red blood cells leading to anemia. The direct Coombs test is used to detect antibodies or complement proteins attached to the surface of the red blood cells. Here we should note that the direct Coombs test is used to test for autoimmune hemolytic anemia. That is the use. Indirect Coombs test. The test detects antibodies against foreign red blood cells. In this case, serum is extracted from blood sample taken from the patient. The serum is incubated with foreign red blood cells of non-antigenicity. Finally, anti-human globulin is added. If agglutination occurs, the indirect Coombs test is positive. Indirect Coombs test is used in prenatal testing of pregnant women and in testing prior to a blood transfusion. These are the uses. Next term is Kernig sign. As this sign is elicited in the following way. Ask the patient to lie down with the face up. Flex the knee and hip in a 90-degree angle and slowly extend the knee further. If the patient feels pain, the sign is positive. If the sign is positive, this may indicate meningitis or subarachnoid hemorrhage. This is a important sign of meningeal irritation. Another sign is Brudzinski sign. For eliciting this sign, ask the patient to lie down and flex the neck, or you can flex the patient's neck. Then forced flexion of the neck elicits a reflex flexion of hip and knees if the sign is positive. So when flexing the neck, if the patient flexes his hip and knees, the sign is considered positive. It is found in patients with meningitis, subarachnoid hemorrhage or encephalitis. Next important sign is Cullen sign. It is a superficial edema and bruising in the subcutaneous fatty tissue around the umbilicus. Causes are acute pancreatitis, bleeding from conditions like blunt abdominal trauma, aortic rupture, ruptured ectopic pregnancy, etc. You can see in the picture the condition sign will be like this. It is named for gynecologist Thomas Stephen Cullen. It may be accompanied by Gray Turner sign, that is bruising of the flank, that we can see in the next slide. This one is Gray Turner sign, bruising of the flank. This may be indicative of pancreatic necrosis with retroperitoneal or intra-abdominal bleeding. You can go through the slides and understand the finding of these various signs and also the important terms. You can expect questions from these important areas, so everyone should be well familiar with these terms. Thank you for watching and see you in next video.